About them gators.
Thank you for coming. I want to talk to you today about hospice and how it can be a positive choice and not a negative choice when you're looking at the end-of-life stages. Considering hospice and palliative care as a positive action when your loved one has been diagnosed with a terminal illness. I would like to take a moment to show the topics I will go over concerning hospice. Number one would be the everyday struggles through a family who deals with end-of-life prognosis alone and frightened. As I work in the field, I see positive effects that hospice has on life at the end of life. As I work in today, I would like to encourage all of you to consider hospice as a positive option for the end-of-life care when you are faced with a terminal prognosis. Allow me a few moments to share misconceptions and benefits of hospice with you. There are a few misconceptions and there are many bonuses of hospice. Hospice is no longer just for cancer patients. Hospice can cover many terminal illness from dementia, AIDS, chronic airway obstructions, and so forth and so on. You don't just have to have cancer to be a hospice candidate. Anything that shows that you have 6 months or less to live makes you a candidate for hospice. Hospice helps manage the pain symptoms through different avenues, medication and massage therapy and caregiving. Hospice offers comfort care and better quality of life to their patients with the use of volunteers. With hospice, they no longer try to cure the disease. They work on the quality of life of a patient. You know, recently, I went through the same thing. I got a phone call from my parents. My last living grandparent has been diagnosed with cancer. The first 10 minutes, I was okay. I wasn't really thinking, you know, I'm just digesting the thoughts. But 10 minutes later, it hit me. This is my last grandparent. I want him to be comfortable. He doesn't want to be cut or treated any farther. So I told my parents, I said, I want you to contact and make a hospice referral and put him on hospice so at least his last days he can be comfortable. And just because you choose hospice doesn't mean that you have given up on the life of the person you're caring for. It just means that you care enough that you want them to be comfortable. You want them to have a better quality of life in their last few days instead of suffering and pain. I'd like to share with you some of the hospice benefits, how hospice benefits their patients. There are many services that are offered by hospice. As you can see here by the chart, we have, starting here, we have the home health aide who provide comfort measures, they provide family support, and they provide the routine referrals back and forth between the case manager. Here we have the chaplain who accesses the patient's and family's spiritual needs to assist with memorial preparations, provide direct counseling, and develop a plan of care. Here you have the volunteers who provide the support at the time of death and during the bereavement. And here we have medical directors who help coincide with the primary caregivers to maintain the hospice side of the medical care. We have a registered nurse who is usually the care plan manager who takes care of ordering the medications and forming talks back and forth with the doctors. Here we have the social worker who developed a plan of care to meet identified needs and give emotional, social, and spiritual and financial needs with the patients and families, and direct counseling or refer patients and families to appropriate community agencies. Now we are aware of the benefits of hospice, we will look at why hospice should be started earlier. Hospice can be offered anywhere you are located, whether it's at home, in a hospital, or in a nursing home. It doesn't matter, hospice can come to you wherever you're at. I have followed my patients from a home environment into the nursing home as they transferred from one area to the next when their condition worsens to a point that their families can no longer take care of them at home. And as I said before, hospice treats the person instead of trying to cure the disease. They no longer look for radiation treatments and other treatments to help the person get over the disease. They work on keeping the person comfortable in a good quality of life. They want them to be stable. They want them to enjoy the last days of their lives. Often hospice is started too late. The sooner you decide to join, the more beneficial it is for the patient. Because sometimes people wait until it's too late, it's the last week, and they only get the comfort care the last week of their life. In other cases, if the prognosis is done early enough, they can in other cases,
no, I'm not.
In other cases, hospice can go for a range from 6 months on, and during the whole time, the patients are kept very comfortable, and they're able to live a good quality of life. In closing, I want to remind you that hospice is a positive action to end-of-life care. Your family deserves the support they get from hospice, the extra emotional support, just someone to talk to, a different face, or someone who you can discuss what's going on with your particular loved one, who understands and who can see the changes also. Hospice, when hospice people come in, usually a patient lightens up a little. They feel the change, the shift, their moods become a little better, and they look forward to the visits. And I would like for you to honestly, all of you, to, when you think of an end-of-life prognosis, to think hospice and see the positive viewpoints of it. I'd like to leave you all with a very special quote from Diane Cecile Saunders, and she said, "You matter because of who you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but also give you life until you die." Thank you.